So, green building.
Truth, really that's all we know. Keep it real and authentic, this truth be told. Only the truth. Tune in, cause you gotta watch. It's like you with us while we kick it in the barbershop. Here to motivate and inspire. Hosted by the real deal and the God Barber. I hope that you ready, keep it funny and edgy. Let's go. You already know. Truth be told, let's go.
Welcome to Truth Be Told. On today's episode, we diving into the silent disruptor of a lot of good night rest, Green. Sleep apnea. Often underestimated, sleep apnea can have a profound consequence, right, on our health and well-being. From the sneaky symptoms to the impact on our daily lives, we got the facts that you need today. I think today is that night, Green.
Tonight is the night.
Hey, man, I want you guys to stay with us, hang in there. We're going to talk about the truth about sleep apnea and also discover some of the keys that's going to unlock the healthier and more rejuvenating sleep. I need it, Green. I can't even lie, dog.
Need it.
I talked about you, but
Yeah.
we're going to talk about me too, man. So, hey, man, let's go ahead and get into it. It's Real Deal, man. I'm one of your hosts. This is my co-host, the God Barber.
Yeah.
The God Barber's in the house.
In the house, baby. In the house.
Green,
What's up?
let's just be honest.
Yeah.
Most nights you sound like a polar bear.
Nah. My
Grizzly
wife.
bear.
No, my wife say I sound like you ever been to the drag strip? And them cars be cranking up.
Not this soda.
Yeah. I sound like a 392 Hemi.
What?
A 392 Hemi. That's an engine inside a Dodge Charger. My wife said, "You lying. I ain't say that. I ain't say that. You lying, too." No, my wife said, My wife said, man, she said I was snoring, man. She said I'd be snoring, but I don't know I snore. I don't know.
So you feel like when you sleep and you know, over a span of the night and you wake up, you feel like you had a good night rest?
I thought I did
Mm-hmm.
until I got myself checked out. Now I realize I sleep better. When I wake up in the morning, I feel better. I feel rested. I feel good, man. I feel good. So tonight, man, we're gonna talk about this.
Yeah, because I got some questions. And,
Yeah.
You know, you ain't the only one.
No, it's a whole lot of people.
It's a lot of.
Oh, it's a
it's
whole lot of people.
folks
Yeah.
out there, you know.
There's a whole lot of people out there snoring.
Yeah.
Ain't nobody saying nothing.
Yeah.
Everybody laughing.
But you.
Talking about my daddy's snoring, my mama's snoring.
I tell you what. Before
All
we
right.
go any further, man, let's go ahead and introduce.
Yeah, go
our
ahead,
guest.
go ahead.
Matter of fact, you want to introduce?
Man, I can introduce him, man.
Yeah.
I can introduce him, man. Hey, listen, I'm finna get right to it. This lady right here, she's a PA. PA stand for physician assistant. Yes, sir.
Certified.
Yes, sir.
Certified though.
Yes.
Put the stamp
Yeah.
on it. You
Yeah.
Certified.
I worked hard for that.
PA.
There we go.
Yeah,
There we
yeah.
go. There we go.
Certified, man. She's work at the Florida Sleep Specialist.
Mm-hmm.
Yeah. Off the 51st and 21st, right?
Mm-hmm.
Yeah. West.
Mhm.
Out west. Out there by Blake Hospital.
Okay.
Yeah. And her name is Regina Pruitt.
And she's here with us
And
tonight.
she's here tonight. Yes, sir. Yes, sir.
Thank you for having me.
Yes, sir.
How you doing, Regina?
I'm good.
Oh man, listen, you came in with, I don't know where you from, but the way you stepped in the building tonight, you know,
Boy, Gina ready.
yeah, she ready.
Yeah,
man.
she
I
ready.
mean, she ready. She's
Yes, sir.
fancy over there. Got her boots on. I don't know if you guys see her boots, but she got her boots on. Got her jeans on. She's sitting tight and right
Yes,
now.
sir.
Got that short haircut, you know. Yeah, I see you.
Yes, sir. Man, yeah,
Regina,
man.
Can I just say this? My wife getting tired of me. I'm just be honest. My wife, Green. I don't know about you. I just know and understand some nights, and I don't told her about this. Do not let me sleep on the couch in the living room. Wake me up.
Mm-hmm.
For some reason, she keeps sneaking in that bedroom. She walks past me,
Mm-hmm.
and she leaves me there.
Because she sleeps in peace and quiet when you're not in the bedroom. I bet.
That's some bull junk.
Do you snore?
I guess.
Hmm.
I guess.
Most people have no idea that they snore. They have no idea what's going on in their sleep because you're unconscious. You're asleep. But snoring is the number one most common complaint that's associated with sleep apnea.
Can they cause people to get a divorce?
I ain't gonna speak to that, but
I'm just making sure. I'm asking for Green. You know what I'm saying?
Oh, okay.
I don't want him to get a divorce, but I see he
Green's
took
got
that.
it right now.
Yeah, I got it right, man.
Green's all hooked up.
Yeah, I'm right.
He's
I'm
good.
right.
He's
Yeah.
sleeping in the bed with his wife, and he is not snoring anymore.
Yes, sir. I'm good, boy.
Well, we gonna get to that a little
I'm
bit later.
good, boy.
But Green.
Boy, I went from a Hemi to a Mercedes, baby.
So Green, let me tell you this. Let me
Uh-huh.
ask you this. What got you to actually, say, let me go see somebody?
Well, my wife told me that I be snoring at night, and I told her I don't know if I snore or not. I can't tell because I'm asleep. So she told me I snore. So I went to get a physical
Mm-hmm.
from a doctor.
Yeah.
Not about snoring, but I always get a physical every year, and everything checked out good. My blood pressure good. Everything good. So doctor say, anything else, you want to talk to me about Mr. Green? My wife, yeah, he be snoring. And so the doctor said, oh, you snore? I said, that's what she said.
Right.
And he said, well, you want to go get it checked? And we like, yeah. And that's what happened. I went and got it checked, went to the Florida sleep doctors. Did I say it right? The doctors or specialists or?
Florida sleep specialist
Yeah,
is fine.
yeah. And met Miss Regina, and gave me a take home.
Yep, a home sleep test.
Yep.
Hmm.
And with that home sleep test, it let me know where I stood at, as far as like with the breathing and stuff.
Yes.
Now, if you can remember, what
I
it was when I first.
I do.
She can tell you.
Well, before you say that, let me just ask you this.
Mm-hmm.
Is this something that's very common?
So the most recent data shows that approximately 15 to 30% of American males have sleep apnea, 15 to 20% of American females. However, that is probably a huge underestimate because of the number of people that never have testing. That's just the percent of population that we know.
Right.
Based on testing.
Right.
But I suspect that there are far more people that have sleep apnea that have no idea.
Now, what exactly is that?
So, obstructive sleep apnea is when the tongue, which is a skeletal muscle, just like your bicep, pecs, when we go to sleep at night, all of our muscles relax. And that includes the tongue. So, the tongue, as it starts to relax and get to the back of the throat, that's where that snoring comes in. Snoring in and of itself is not a major issue in the situation. However, most people that have snoring, that is an indication of possible apnea. So apnea occurs when the tongue gets all the way to the back of the throat. It's like a cork in your airway. So when that happens, breathing stops. Then your oxygen goes down, carbon dioxide goes up, and the brain has a job. It can either let you stay asleep or it can keep you alive. And it's always going to choose keep you alive. So at that point, the brain kind of goes on high alert. And it causes your body to make adrenaline and cortisol, which those are the fight or flight hormones. Yep. And the reason it's doing that is because it's trying to pull you out of sleep at least enough that you'll, and you take that breath. Oxygen comes back up. Carbon dioxide comes back down. But as soon as you drift off again, there it comes again. Okay. And what happens is if this is occurring over and over again all night, it actually puts you at a 40% increased risk for heart attack, heart dysrhythmia like atrial fibrillation, stroke, early onset dementia, puts you at risk for pulmonary hypertension, systemic hypertension, and also increased risk for cancers.
Wow. Wow.
And it messes with your sex drive too, don't it?
Yes. It can also cause changes in mood. Some people can become more irritable. Yes, it can decrease your sex drive because obviously, every time you stop breathing, you're not getting enough oxygen anywhere, including. So over time, that can
Is
be
that
very
my problem?
detrimental.
Doc, is that my problem?
Now I don't know that,
Yeah,
but
I mean,
Sex
I'm
drive, boy.
trying to figure
Hey.
it out.
You better get checked real.
I gotta go get checked.
I'm trying to tell you, boy.
Yesterday. So
Ain't
cortisol.
no pony riding in there, boy.
I heard you say cortisol.
yes,
Cortisol, is it cortisol?
cortisol,
Cortisol.
stress hormone.
All right. So I was reading. Well, actually, I was listening to something, and it was talking about how the cortisol is released a lot. I guess mainly when you're about to wake up, you release
Yeah,
more.
for normal
For normal.
situations. Yes, yes.
And also, it was saying how when people die. I don't know. I was just listening. I'm saying people normally die in between 6 and let's just say noon, but people that have sleep apnea, they pretty much die in between midnight and 6 a.m.
Mm-hmm.
And so that was kind of, well, Green, you sleep
Yeah.
between the hours, bro.
Yeah, man.
Well, think about it. If you're stopping breathing and your brain is having to get the body to make the cortisol and adrenaline, that means that your baseline everyday levels of cortisol are higher because you've got this going up and up all throughout the night. Because when that happens, blood pressure goes up, heart rate goes up. It's a lot of stress on the heart. But also, cortisol is one of our caveman hormones.
Okay.
And the purpose of it at that time was to preserve body fat and sugars so that when you come on to, a lion that's running at you, you have reserve energy to run away from that lion.
Okay.
But of course, now in today's society, we have no need for that, but we still have that hormone present.
Okay.
And literally during the night, what's going on in your body is just the same as like if you were at Walmart and let's say you had you got a G-Wagon, okay? So you park way at the end of the parking lot, way away from other cars. And you're coming out of Walmart, it's late at night, and then from behind another vehicle pops somebody with a gun in your face. That you feel, that's the same hormones that course through you every time you stop breathing at night. Now, for
Wow.
T, that happened to him 26.6 times an hour.
Wait, hold on.
Hold you real.
So he go to bed at midnight.
Mm-hmm.
You wake up at 6. So what that is, 6 times 26. So he actually kind of stopped breathing that much.
Not kind of, he did.
Mm-hmm.
And one thing, also a little caveat, it's not only that you stop breathing, it's when you stop breathing for at least 10 seconds and we see a drop in your oxygen at the same time, specifically. So I can't recall what the longest event you had was.
You said I thought it was a minute. Was it
It was over a minute,
Yeah,
but
a
I
minute
can't
and a
remember
half or
exactly.
something?
Wait,
It was
what
it
you
was
mean?
like 90 seconds.
Wait, what you mean? He wasn't breathing?
So
Yeah.
right, so
Say over a
the
minute and a
longest time when he,
Yeah.
the longest time he
That
spent
court got
not
enough.
breathing,
Yeah.
Mm-hmm.
a minute and a half. You probably couldn't sit here and hold your breath that long, but that is happening in sleep because your tongue is in the way.
Because when she told me, I said, well, shoot, I was dead.
He did.
Yeah, remember I said, I was dead. She said, no, you wasn't dead. Well, if I wasn't breathing.
You played. Hey man, that's
I'm
that's-
serious, man.
So, all right, he wasn't breathing over 90 seconds, whatever.
That was the longest.
That
The
was
longest,
the
yeah.
longest period.
But all of the others we know were at least 10 seconds long.
So why? So in that, I just say he had those 10-second spurts, right? 10-second spurts, 10-second spurts, and then boom, he got that minute one.
Mm-hmm.
Like his brain was like saying, "All right, we just gonna tease you a little bit, like we just play with you a little bit." I mean,
No, the brain would automatically just go in full force with causing the body to make that adrenaline and cortisol. Like, oh, we
So
got
it
to
has
wake
to
him
make
up.
that
We got to,
cortisol.
yeah, the body, it causes the body to make that. Because the brain is like, wake up, we need to breathe.
wow.
Mm-hmm.
Because to be honest with you, I didn't think it was that serious.
He said to me when I first met him, his first visit, when I asked him, do you wake up feeling tired or do you wake up feeling like you've had good sleep? He's like, I feel fine. I
Right.
feel fine during the day.
Mm-hmm.
But now,
Yeah.
looking back, what would you say now?
I wasn't feeling fine. But see, I probably was so used to feeling that way.
Yep. Yep.
I just thought it was normal.
That was your normal.
Yeah.
Yep.
Right.
But now I feel, man, even when I started just reading up on it,
Mm-hmm.
sometime I wake up, I have slight little headaches,
Mm-hmm.
you know. And now that I've been to the sleep specialist and stuff, I don't have those no more.
Mm-hmm.
I just feel good.
That's because low oxygen and high carbon dioxide
Mm-hmm.
can cause you to have a headache.
And you know me, I stand up all day at my job,
Mm-hmm.
cutting hair. I stand up all day, all day.
So how long can somebody be like doing this and not knowing that they have it before something fatal happens? Like, or is it no? It's just every case is just.
Every case is different, and it depends strongly on what other health problems you have. I'll tell you, a lot of our patients come from cardiologists after a patient has had a new onset of atrial fibrillation, because we know that sleep apnea can cause that.
Okay.
And then, we do sleep testing, and boom, there it is.
So it's my understanding that there's different. You say that Terry had obstructive.
Yes, so obstructive has to do with literal obstruction of the airway.
Okay.
For some people, that also means like a concentric collapse of their airway as well. Most people with obstructive have the issue with the tongue. And, there are almost every patient that I see that has sleep apnea, they have a tongue that's a little bit larger in their mouth. One way you can tell if somebody's tongue is too big is if they have these little ridges on the sides. And that's because the tongue itself is not fitting behind the teeth. And then when the tongue presses against the teeth, it's making those indentations. But when you go to sleep at night and the tongue relaxes, because like sitting here now, you can try to relax your tongue. It's going to be very difficult because the thing wants to wiggle all the time. But once it relaxes, of course, it's not going to sit down, underneath the teeth. It's going to take up more room. And then on top of that, if you've got like a bigger neck or you've got a small airway in the back, like very narrow room from where the tongue is to the back of the throat, if that's narrow, then it don't take much for that tongue to get all the way back there to plug up your airway.
Wow.
And then there's also central sleep apnea. Now, central could be broken down into primary central sleep apnea and treatment emergent central sleep apnea. So for primary central sleep apnea, that's a whole different issue. That's when your brain is not signaling to your diaphragm to pull down and make you breathe. So some things that can cause central sleep apnea are like use of pain medications, opioid pain medications, because that suppresses the respiratory center in the brain. Also, people that have had strokes can suffer from this. Parkinson's can cause it. People that have had some sort of traumatic brain injury can have it sometimes. Now, the treatment emergent central sleep apnea is a little bit of a different animal because for a person that has obstructive sleep apnea, what can happen is the chemoreceptors in the brain that detect your carbon dioxide, they get a little lazy, kind of, and it usually happens, we see it often when people have had sleep apnea for a long time and maybe they've not ever been diagnosed or never sought treatment. But over time, those chemoreceptors become less and less sensitive to blood levels of carbon dioxide. So what drives us to breathe is not low oxygen, it's actually high carbon dioxide.
Okay.
So over time, with the carbon dioxide levels being able to go up and up because the brain is not sensitive enough to that, then people can develop this treatment emergent central sleep apnea. Once we treat their obstructive, then all of a sudden, the brain, because it's been having this issue for a while, you correct the whole issue with the tongue falling back, and then the brain is still kind of lagging behind sometimes. And so that typically requires either one of them, primary central sleep apnea or treatment emergent central sleep apnea, often involve a BiPAP, or there's three kinds of BiPAP, but it often involves a more advanced machine that helps with inhalation as well as exhalation. So those are a little bit more difficult to treat sometimes because if there are multiple components going on there.
So
That's 3. Then you got another one. What, mix?
Yeah, mixed
that's
is
the both.
basically when you have a little bit of both.
Both, yeah.
And there are some events that occur that aren't clearly delineated as obstructive or central, and that's when it's called mixed. And some people on their diagnostic test, they've got obstructives and they've got centrals. And so that can be referred to as complex sleep apnea sometimes.
And that can lead to surgery, right? Sometimes they have to go inside and.
Well, one of the treatment options for obstructive is surgery to like remove the tonsils, the soft palate, the uvula. Now, from my experience, people that have that surgery may have an improvement in their snoring sometimes, but we have several patients that have gone through that surgery and it's quite painful. Then they still have sleep apnea, still end up with other treatment.
So
Goodness, man.
Green, I'm gonna say something, but I hope this is not your case. So my boy, if he gets this corrected and the brain says or whatever gets lazy or whatever, he can then have the central?
He could have treatment emergent central. Yeah, that could develop.
I'm gonna put my hands on you, man. 'Cause I'm just put my hands on you.
But
God, please, whatever you do.
What could it be? Could you get off the machine?
Well, so the root of that question is, does sleep apnea resolve?
Yeah.
Okay. On average, for every 10% of body weight you lose, if you have extra weight, for every 10% of body weight you lose, that 26.6 can be cut in half. You lose another 10% of body weight, that number's cut in half. We have a lot of patients that have resolved their sleep apnea with weight loss alone. So some things that make you be at a higher risk for obstructive sleep apnea are being a male,
Yeah.
aging, getting older, particularly after the age of 50. If you have extra body weight, obesity or morbid obesity. If men have a neck size greater than 17 inches or women have a neck size greater than 16 inches, that increases your risk. Having high blood pressure increases your risk, as well as sleep apnea increases your risk for high blood pressure. It's kind of like a negative feedback loop there. People that have any sort of like neuromuscular disease, like maybe muscular dystrophy or cerebral palsy or any variety of disorders like that can also be at higher risk for sleep apnea.
I'll tell you what.
Dang, boy. So basically, if you overweight,
That
it's
is
a possibility
probably the
you
number
have.
one contributing factor to most situations with sleep apnea. Now, I will tell you, there are plenty of people out there that are skinny as a 2x4 that still have sleep apnea, maybe even severe sleep apnea. They don't have weight to lose. But when we dig down and look at that, it's usually, well, I'd say 99.9% of the time because of their anatomy, which they can't change. If they just genetically speaking, if they have a naturally bigger tongue or a very small airway, or maybe their jaw is recessed back, we call that retrognathia. So basically the chin, big overbite, the chin is way back. Of course, that's going to limit the area that can be open while you're sleeping because the jaw and therefore the tongue are pushed back further towards the back of your throat.
Well, I'll tell you what, Regina, we're going to go take a really quick commercial break, but I want to tell you what I tried to do to help my wife out when she stepped beside me.
Gave her earplugs.
We'll be right back. Hey, what's up? This Real Deal with Truth Be Told, and we back, man. Just real quick. Hey, Green, today is going to be really good, man. We got some nice stuff.
Yeah.
But in the meantime, we always talk about subscriptions, right?
Yeah.
Hey, we need subscriptions, man. We at about 900. We on the road to 1,000. We need about 1,000. You guys can help us out, man. Go ahead and hit that subscribe button while you're watching. While we take this quick little intermission, hit that button real quick so you can join this journey on the truth, insights, and
hit the button, man. Hit the button. We said, where we at, 900?
Yeah, about 900.
Oh, we can get 1,000 tonight, man.
We get 1,000?
Yeah, we're going to get 1,000.
One night?
Yeah, we're going to get it tonight. And if we reach it tonight, man, I'll buy everybody some fried chicken. Yeah. Yeah, everybody.
You
Everybody, yeah, yeah.
You must be talking about the black folks.
White folks eat chicken too.
Oh,
They eat chicken too, man.
yeah, okay.
But look, they only gonna get one piece. They ain't getting no meal now. One piece. So hit the subscribe button, man. Please, YouTube. Hey, man, we doing this thing big, and we just trying to keep this thing going, man. Please hit the subscribe button. Help us out, and let's do this.
All right, let's get back to this episode. All right, we back, man. Hey, Green.
We back.
For the break, man, I was just saying how I wanted to share what I attempted to do.
Boy, I got to hear this. I got to hear this.
You know, on Facebook, you always be strolling, right? And you know how Facebook always be reading your mind nowadays. And you talk about it, you type something in, it's going to always pop up with some type of advertisement, right? So I saw this thing, right? I don't know why I did it. Maybe Green was talking about it in the shop and you said something about snoring. I don't know. But I guess
Boy, I
that's
got to hear this.
You know, I saw this ad that said, hey, you know, if you want to help with snoring at night, try this, right? So I can't remember the company name, but when I got the product, it looked like a mouthpiece, right? So I said, you know what we'll do?
Like a football mouthpiece?
Like a football mouthpiece. Like it had a top and bottom. It had a top and bottom though. Like you going in to put mold your teeth, right?
Oh,
so
boy.
I said, you know what I'm gonna do? I'm not even gonna tell my wife. I'm not gonna even tell her. I'm gonna surprise her, right? So I'm gonna get in bed like we normally do, and I'm gonna put this device in my mouth, and in the morning I'm gonna wake up and I'm gonna say, hey, how was last night? You know, how did you sleep last night? You know? So I did it. So it was difficult because it was kind of odd having that in my mouth, but I did it. Woke up and I asked, how was your sleep, baby? How did you sleep last night? She said, oh, boy, you slept good. Boy, you didn't snore. You didn't do none of that, right? You were good last night. I said, you know what I did? So she had no idea. So I showed her the device that I put in my mouth, but the problem is, it's so uncomfortable. I had my whole jaw sore for a couple of days.
Well, let me tell
after
you.
that.
One of the treatment options available, FDA approved for the treatment of sleep apnea, is a oral appliance for sleep, mandibular repositioning or advancement device. The difference is you're not going to buy a mold online from some ratchet company and then expect that to work. So you have to, right, you can't get some prefab thing and expect it to work. So you have to have a dentist who specializes in this. And what they do is they basically make, it's kind of like a mouth guard, but it's custom made for your teeth.
Okay.
It fits like a glove on the teeth.
I heard what you're saying. You said I went the cheap route.
Yeah.
All right.
Yeah.
Got you a little quick fix. A little quick fix. Yeah, a little quick fix.
That's what it was.
Yeah, and what it does is it's adjustable. So, you know, you don't want to go from normal chin to chin jutting out. And the way that the mandibular repositioning device works is as you get the jaw forward, because the tongue originates in the back of the jaw here, it also gets the tongue forward.
Yeah.
Now, caveat, people that have moderate to severe sleep apnea, it's usually not that effective. But people that have mild or, you know, just over the line to moderate, it can be an effective treatment. And it just takes a while for the dentist to get it in the right positions. And then in order to see, is this thing effective, then we do home sleep testing with it in the patient's mouth to see if it's effective to treat their sleep apnea. And what we're looking for is for them to stop breathing 5 or less times an hour. Because it's actually normal to stop breathing for 10 seconds up to 5 times an hour. So if a person sleeps 8 hours in a night, it's absolutely normal to stop breathing 40 times. That's normal. Everybody stops breathing. When it becomes abnormal is when it's more than that. So if a person, if a person stops breathing 5 to 14.9 times an hour, that's in the range of mild. 15 to 29.9 times an hour, that's moderate. More than 30 times an hour is severe. Now, me personally, the worst I've ever seen was a young guy who he couldn't hardly keep his eyes open. His uncle had come with him because he had to drive him because the kid was falling asleep driving. He was in his early 20s. 130 events per hour. And his oxygen got into the low 50s, and it was below 88%. So your oxygen, even while you're sleeping, should be 88% or above. But he got down below 88 for about 75% of his total sleep time. So we had to bring him into the lab to see, okay, what device and what pressure is going to be needed to not only correct the sleep disordered breathing, but also allow for his oxygen to be sustained and not drop that low for that long.
And that's why I messed up. Remember I told y'all I stopped breathing for 126 times?
He told me that today. I was
Yeah,
like,
I messed up. I misheard her.
Okay. Yeah.
I'm glad I didn't stop breathing for 126 because that'd
well,
have been.
the total number of times, I would have to go back and look and see the time spent. But, I mean, I would have to add them all up, but it could have been more than that. Honestly, the total number of times that you stopped throughout the night.
Yeah.
But when it comes to diagnosing sleep apnea, the number that matters is how many times per hour. That's the apnea-hypopneic index.
Oh, okay, okay.
So, of course, we know that, the brain without oxygen over a period of time can cause some serious issues. I guess my question to you, and I think you're hitting it, but I just want to make sure. My understanding, over 5 minutes, no no oxygen to the brain can be severe damages. If you have all these series of events that last that long, it's not that it's not reaching the 5, but it just
It's a cumulative effect.
Right.
It's periods when you intermittently don't have enough oxygen.
Right. Could it potentially cause brain damage?
Well, yeah, it could cause a stroke. We know it's linked to early onset dementia. If a patient has dementia and also has sleep apnea, it can definitely worsen that. Which all of this together is why a lot of people with sleep apnea feel like they kind of have brain fog throughout the day. They feel like they're just not as sharp as they could be. And they might not recognize it until they get treated. And then looking back, they're like, oh man, I had a lot of difficulty studying or a lot of difficulty doing my job. And it's not until they get treated that they really realize how bad it was, just like T.
Yeah.
Well,
I'm so glad. Boy, I got treated. Boy, I'm so glad.
Let's talk about the treatment.
Yeah.
For, since T is a patient,
We're going to talk about a
The
real
gold
machine.
standard treatment is PAP therapy, and that stands for positive airway pressure. What T has is an auto
I don't know
CPAP.
if they can see this. I don't know if they can see it. Y'all can see this? Y'all can see this? Yeah, y'all can see that? Yeah.
Yep.
Yeah.
So
This ain't
device-
come off. It ain't no Amazon right here, real. There ain't no mouthpiece right here, baby. It's real deal right here, boy.
All right, you got me.
Yeah. All that football mouthpiece stuff.
Yeah.
No, man.
No.
Okay.
No, this real deal.
Okay.
So the way that this machine works is it's basically like a air stent to keep the airway patent while you're sleeping.
Now, what does that mean? Patent? I don't know. What's that?
Keep it open
Okay.
while
okay,
you're
yeah,
sleeping.
be sure.
Yeah.
This
So
me here,
his is set on an auto range of pressure. And so it automatically adjusts to his breathing throughout the night, because there's periods when you don't need as much pressure if you're in lighter sleep, and then you get into deeper sleep and you might need more pressure. And his device automatically adjusts throughout the night for him to be able to have his airway open. And when I saw him today, so keep in mind, when he had his testing, he stopped breathing 26.6 times an hour. Now, with therapy, it's down to, what was it, 0.4?
0.4.
4, yeah.
Oh, that's pretty good, boy.
I'm
With
normal.
treatment.
You getting
Yeah.
healthy, baby.
Yeah,
Yep.
man.
With the
Yep.
walk-in and the...
Transformers.
Robots in disguise.
So, okay, when I first saw it, I thought that would go in your mouth, but that go in your nose.
No,
No,
right.
no. So there are this is the key thing for people to be able to do CPAP therapy. Most people are afraid of, a Darth Vader mask or looking like an Air Force jet pilot, you know. But there are hundreds of different. I don't even like to call them masks. The technical term is interface.
Okay.
So you have to have some way to deliver that air pressure to your airway, and that could be through something like T's got, which are little bitty pillows. Take that off and show it from your view. Like that.
Okay.
There's several different types of even that. There's also some that are like a little triangle over the nose.
But this one felt comfortable to me. They let me try the other ones, but I like this one.
Okay.
Yeah.
Okay.
And we do have some full face masks that, you know, are a little more obtruse. But we have a lot of people that go to the pillows. Now, if a person tends to mouth breathe all night,
Yeah.
what would happen if you have just a nasal pillow and you open your mouth while your CPAP's going? That air's not going to be going to your airway. It's going to come right out of your mouth,
Okay.
which is definitely going to wake you up. Plus, you're not effectively treating your apnea. So for those type patients, a mask that fits over the nose and over the mouth, or can fit a new style of masks that have come out in the last few years. It's called hybrid full face mask. It fits under the nose and over the mouth, and it has holes so you could nose breathe or mouth breathe.
Okay.
And and the air come out too, man. I'm talking about. I think my pressure is what, from 6.
I think you're set on a range of 6 to 20.
Yeah.
But most of the time, the pressure that you are needing to correct your apnea, I believe it was around 12. If I can
I'm talking
recall.
about it come out strong, but when you put it on your nose, you don't feel it like that.
So is it medicine in that? Or
No.
Is it just
No.
straight?
So his machine pulls air from the room. There's no oxygen or anything, but his machine
Okay.
pulls air from the room, and
Put water
then
in this
it goes through the tube, through that little nasal pillow, to him.
Okay. Now, that's interesting.
Now it could be a little bit
And it's
of
quiet too. It's not
yeah,
loud.
well, if you got a good mask seal, you don't hear that thing.
You don't
at all.
hear it at all, real. It's quiet. You don't hear nothing.
Okay. Okay. So
This ain't no mouthpiece here, homeboy.
no, it's not a mouthpiece. That's a whole gadget.
Yes,
right
sir.
there.
Yes, sir, boy.
I mean, so he's been on this machine now for how long?
Gotta be 2 months. or
Yeah,
more.
about 6-8 weeks.
And he's already seen positive impact because of this machine.
Positive. I'm back breathing normal again, real. From 26 episodes to .04, that's less than 1.
Right.
I'm good.
Wow.
I feel good. I don't feel as tired in the morning.
Yeah.
I feel good compared to what I felt before all this.
Right.
See, before all this, I thought I was
You
natural.
thought you were feeling good.
Yeah. I was getting headaches and even cramps. Sometimes I catch cramps sometimes. I thought it maybe because I just be standing up all the time. But all
Probably
that
'cause
crampness
it
come from
didn't
being
have
tired.
oxygen. Your
Yep,
muscles
yep.
are like, oh crap.
Yeah.
So is there when we talk about cultural factors, right?
Yes.
Is there a difference when it comes down to the black community?
Absolutely. So, number one, due to things that have happened in history that some people don't want to acknowledge, but they're there, the African American community sometimes is a little hesitant to go see a doctor.
Yep, that will be us.
They're worried about being stigmatized and, people judging them for whatever reason. Now, I grew up in the South, so I can speak to the fact that also, typically in Southern African American culture, the foods, high fat, high salt, a lot of carbs. I mean, you get down at a backyard barbecue, Well, all of those things also put you at risk for high blood pressure, increased body weight, things like that. And to me personally, and y'all can speak to this, but I feel like, because I have a lot of African American friends, and they have told me before that if the only available doctor for them to see is someone that's white, they don't want to go because they're afraid of these adverse events that can happen when other people are ignorant.
Yeah.
And so, for me personally, I try to treat each of my patients like a family member. regardless. And because I grew up in South Mississippi and I had a lot of African American friends, spent the night at my house, you know, we hung out all the time, we were in dance crew together. You know, it's just not a big deal. So let me ask you, did you feel like I was accepting of you on your first visit? Did you feel comfortable in your first visit?
Yeah.
Good.
Man, the
Good.
whole office,
Yeah.
everybody in there, man.
And yeah, that's
It just
that's
make you feel.
really how all of us. We have a nurse practitioner named Candy, and then Dr. McConnell. That's how we want to create an environment
The
that
whole office, real everybody.
is accepting
Yeah.
and is kind and caring and sympathetic, and we try really hard to do that.
You know what? Another thing too, that can cause it. I think I read when you drink and getting drunk before you go to sleep.
Good thing. Yeah.
And a lot of cats we know be drunk.
Yeah,
and go to
a lot
sleep
of
drunk.
people will tell us, you know, if they have difficulty sleeping, they'll drink a couple of glasses of wine, or they'll, you know, hit a shot of some bourbon or whatever. And the fact of the matter is, alcohol also suppresses the area of the brain that tells you to breathe. So people that drink nightly, they're at higher risk for having sleep apnea. Absolutely.
Yeah.
Wow.
So man, look, y'all. If y'all looking at this, y'all snoring, y'all wives, y'all girlfriends, y'all moms, grandmas, tell them husbands, tell those boyfriends, tell them brothers.
It's women too, though.
Yeah, women too.
Your auntie
Well, I'm just
snoring.
saying.
Get down now.
I'm just speaking to people that I know.
Right.
There's some people out there snoring, and they know they snoring, and their girlfriend, wives, moms, and grandma is not telling them. You know, y'all about to tell these people, man, this stuff can be deadly.
Yes.
Can be deadly.
One last thing before we go, because we know, all right, the treatment, but there's a price that comes along with it sometimes. Is this stuff normally, like this machine, is it covered by insurance?
Yes. Now, it depends on your particular policy. It depends on your deductible, what your copay for other things is. But with sleep testing, we've got medical evidence of that necessitates whatever the treatment is. So insurances have to cover it. Especially like we have a lot of Medicare patients, and honestly, Medicare covers things around sleep, whether it be testing or, you know, treatment. They cover really, really well. And we prefer, so we have 4 sleep labs in our clinic, and we prefer to do our testing in the sleep lab. It's the insurances that cause us to have to order a home sleep test, because insurance, most commercials, well, all commercials, will not pay for an in-lab sleep study as your diagnostic test. So then we have to go to the home sleep test, because I'm not going to order something that your insurance isn't going to cover. I'm not going to ask you to pay out of pocket for that.
Right.
So that's where, I mean, that's not our preferred first step, but because of insurances, that's what we have to do.
So,
Now, like if he started having a situation where he's waking up a bunch during the night, we see that even though he's using his device, his events per hour on the data is going up. Well, then insurance would pay for him to come into the sleep lab so that we could kind of evaluate what's going on and what's the best course of action. But in regards to a first step study, Medicare and TRICARE are the only 2 that will cover an in-lab study.
okay. So, and just because I hear you say in lab, so when you say that, I'm thinking I'm gonna pack my bags, I'm gonna come in to you guys, I'm gonna sleep over.
Yeah, you are.
Yeah.
And you guys gonna put me in this big old machine. Is that,
No, it's not a big machine.
But go be
Yeah, you would come and spend the night. But basically, we are monitoring a lot of things. So you would have EEG leads on your head, because we're tracking brainwave activity so that we can see stages of sleep. You'll have something monitoring your oxygen level. We're watching cardiac activity all night. We have different little things on you to measure snores, to measure effort to breathe. So that's another thing, central sleep apnea. When that does occur, it's when you stop breathing and there's no effort. So with the tongue in the way, you know, the abdomen is You're trying to breathe. In central apnea, you stop and your body isn't trying to breathe. Anyway, we're also monitoring like limb movements and stuff. So, I mean, you've got little stickers all over you so we can monitor all this. And you might say, how the heck am I supposed to sleep in that? People do. People do.
You getting some sleep juice?
Sometimes we do provide them with a
Look.
one-time prescription medication for that night if they're like really anxious or we know that they've had a history of not being able to complete an in-lab sleep study. But you're in a room by yourself. We try to make them look like bedrooms as best we can. Bed, bedside table, TV, although that's not good sleep hygiene to watch TV while you're in bed. But anyway, I digress. And there's bathrooms nearby, so you're in a situation where you're by yourself. But there is a camera in the room because we need to be able to watch activity during the night. If you start talking in your sleep or acting out your dreams, or you get up and try to walk, and anything like that, not only for your safety, but to document that kind of observed behavior.
So let me ask you, what got you into the sleep? Yeah, sleep specialist, and how long have you been doing this? As far as like being a
PA? Well, so I've been a PA about 17 years, I think. When I came here to Florida in 2020, I was initially working at a clinic in the Clearwater area that was pulmonary, sleep, and allergy. And then through a series of serendipitous events, I met Dr. McConnell, and the fact that, he was doing just sleep, because I really wanted to hone in on one or the other. Pulmonary, I did like, but I have a genetic pulmonary disease, so I was a little hesitant to really dive off too far in that, rounding on patients with certain infections that I am highly susceptible to. So really, sleep was where I wanted to kind of, hang my hat. And Dr. McConnell has been great in regards to teaching me, reteaching me about some things that I previously learned from another doctor that weren't exactly correct, because we try to do things based on guidelines provided by the American Academy of Sleep Medicine, which is a bunch of really smart doctors that know more about sleep than anybody should. But I really enjoy, one, taking care of people. But it's really cool to see, you have a patient that walks in that's like drowsy, bags under their eyes, complaining of how tired they are. We diagnose them, get them going on treatment, and then to have them come back bright-eyed, like the guy I was talking about earlier that stopped breathing so many times. When I saw him in follow-up, he was chipper. He had driven himself. He was, he was with it. He was not sleepy at all, didn't have dark circles under his eyes. And he was just about in tears telling me how much his life had improved with treatment.
Well, y'all heard it, man. Y'all
heard it, man.
Hey, Green, somebody come up to your shop looking like Batman.
Hey, boy.
Tell them to see.
Man.
Man.
Yes.
Y'all need to go see him.
Yeah.
Florida
You
sleep
got to go see
specialist.
him, man.
Florida
Yeah,
sleep
man.
specialist.
Call.
So Regina, what's you work for? Who?
Florida Sleep Specialist. We are at 5717 21st Avenue West in Bradenton. Our phone number is 941-792-8383. We also have an office in Sarasota, and I don't have that address memorized. I apologize, but we do have the two locations, and whichever one is most convenient for a patient is where they should go.
Well, you
Yeah.
heard it.
There it is, man.
Well, Green, you know what you always say, big dog.
Man, this is what I always say, Regina. Everybody can talk, but everybody don't tell the truth. And we told the truth tonight.
Truth was told
The
tonight.
truth was told. So, hey, look, if y'all out there sounding like a 392 Hemi, y'all need to go see Miss Regina Pruitt tomorrow. Hear me? Tomorrow.
Absolutely, we'll be glad.
All that right there. At night. Boy, I want to get that engine fixed.
Yes.
Boy, I got my engine fixed, boy.
You got that engine fixed, baby?
Boy, I got oiled up, boy.
Man, you got me a
Got
little
me an oil
jealous.
change,
I can't
boy.
Lie. I can't lie. I'm a little jealous.
Well,
Man,
so
I
when
gotta
you
go.
gonna call and schedule an appointment?
I'm coming next. I'm coming next. I'm coming
Okay.
next for real. You gonna see
All
me.
right,
You
all
gonna
right.
see me. You got to see me. You know what
Yeah.
I'm saying?
Absolutely.
Yeah.
So
We'll
man,
get
listen.
you going.
Hey, you guys make sure you
Yeah.
not only if you having those issues, reach out to a specialist, but also, man, you know how we always say, man, we on the road, we on this journey to get a whole bunch of subscribers. So make sure you just hit that button. We'll be back next week with our last episode of
Yeah.
season 11.
Caveat: we don't treat just sleep apnea.
Okay.
We treat any sleep-related disorder, whether it's narcolepsy, insomnia, hypersomnia, the whole gamut that involves sleep. We treat all of it.
Hey, once again,
Yeah.
you got it.
You
Hey, I
got
don't
it,
got
baby.
nothing else to say. I guess we just got to end it on that.
Got to end it, baby. Because I'm sleep good at night.
Yes.
Hey guys,
I'm
this
sleep
Truth Be
good at
Told.
night.
And thanks again for tuning in. We'll see you guys next week. We out.
We out, peace.
Truth, really, that's all we know. Keep it real and authentic. This truth be told, only the truth. Tune in, cause you gotta watch. It's like you with us while we kick it in the barbershop. Here to motivate and inspire. Hosted by the real deal and the God Barber. I hope that you ready. Keep it funny and edgy. Let's go. You already know. Truth be